Now, we're gonna do the eye muscles. To just review for our purposes, most of these eye muscles, they originate from the orbit, the bony orbit. So that's the bone in the eye socket. They insert on the eyeball. We got 6 of them that we talk about. We got 4 of them that are quite simple and 2 that are a little bit more complex. When we look at this eyeball, our reference point is the lacrimal gland, and that's on the outside. So this is the right eye. So the lacrimal gland is always lateral. So we have 4 muscles that go straight. One on top, one on the bottom, one on the inside, one on the outside. And those are called recti, or one rectus. A medial rectus, and that medial rectus brings the eyeball medial. We have a lateral rectus, and the lateral rectus brings the eyeball lateral. We have a superior rectus, and the superior rectus brings the eyeball superior. We have an inferior rectus, and the inferior rectus brings the eyeball inferior. So those are pretty simple to understand. Then, however, we have 2 that are oblique. They come in an oblique. Inferior oblique starts at the medial orbit of the eye. So that's over here if this is the nose and this is the outside. So it starts here, it wraps around the eyeball. So the inferior oblique, when it actually contracts, the way it's located, it kind of brings the eyeball up and out. And the super oblique starts at the orbit back here like everybody else, all the recti muscles, but then it moves and it has a trochlea, a little pulley that comes in from the medial orbit, and the tendon of that muscle makes a 90-degree loop and it inserts in the eyeball sort of on the superior-lateral aspect of the eyeball, more or less. And what that muscle does when it pulls on it, it brings it out and down. So the inferior oblique brings the eye up and out, and the superior oblique brings the eye down. Picture it, which I tried to have you picture it, but if you cannot picture it, what I like you to do is just memorize those. Superior oblique, down and out, which is not up and out, and inferior oblique, up and out. Good for that.